Yeah. Well, it is a pretty common condition. About half of the population has some form of vein disease, and most commonly varicose veins affect between 15 to 25% of adults and 50% of all people over the age of 50. This largely hereditary condition affects more women than men, but there is a place in our region that treats vein disease. Dr. Alexander Matz is the founder of Atlantic Vein Clinics, which has clinics in several locations in Nova Scotia: Halifax, Mineville, Truro, and Yarmouth. And the vein clinics are going to be at the Optimize Live show this weekend in Halifax. Dr. Matz, thank you very much for joining us.
Thank you very much for having me.
Now, when you talk about vein disease, a lot of people think varicose veins. It's like the first thing they think of. But it comes in many other forms, right? What are some of the different things you deal with?
Well, the most common one, most severe one, it is varicose veins, which are large rope-like veins, which you can see underneath the skin.
Right.
But there are smaller veins, such as what we call reticular veins, which are smaller greenish, bluish-looking veins underneath the skin, or so-called spider veins, which are inside the skin.
Right. So what we're looking at here right now, is that varicose veins there?
Yeah, this is the varicose veins.
Wow. So what is the concern if you leave them untreated? I mean, why should you kind of deal with this instead of just leaving it?
Well, first of all, some people have symptoms such as aching, burning, cramping, restless legs, numbness, so on. And they can become complicated. They can rupture and bleed. They can get inflamed, and then it becomes thrombophlebitis, or they can bring a condition which is called deep vein thrombosis, and the most extensive complication is ulcer. Ulceration. About 20% of all people who have varicose veins, they will get ulcer.
I'm surprised that there's so many people, especially over the age of 50, that have them. What causes them?
Well, it's basically disease of valves inside the veins. Veins, the vessels which are supposed to bring blood to the heart back from the legs. And if the valves are not working properly, what happens, the blood will start going back down, which will enlarge the veins, and it will bring all of the symptoms.
So why does that happen?
Well, like I said, because the pressure, each leg has two systems of veins. One is deep system and one is superficial. The deep system is more important, and this deep system brings blood back to the heart.
Right.
Now, blood from the superficial vein from the other side is supposed to flow into the deep system, and it flows against the gravity.
Right.
Now, if the valves are working properly, then the blood will keep going. If the valves are not working properly, it will just
stay down. Why did the valves stop working?
Well, there are a few factors which can be implemented here. First of all, it's hereditary disease. If you have two parents who had varicose veins, almost guaranteed you will get one. If you're a female, if you had been pregnant, 3 or more pregnancies is a quite significant factor. Stationary jobs, sitting jobs or standing jobs, they can be a factor as well, yes.
So how do you treat them?
Well, there are few options. First of all, the simplest option is compression stockings.
Right, I've seen those.
Yes, and they're very, very effective. And I think the people who have varicose veins, they should use them. Class 3 stockings, that's the effective ones. There are some other treatments available. Treatment which I think is state of the art and basically the gold standard now, which is non-invasive or minimally invasive non-surgical treatment. It's an endovenous ablation.
Right.
What we're doing at our clinic, it's called endovenous laser ablation, which is a totally non-invasive office procedure. Patients in and out in about an hour, hour and a half, and there is no restrictions.
Oh, wow, okay.
Afterwards.
And how long does it take?
The procedure?
Yes.
About an hour.
Oh, wow. So no time at all. And it really makes quite a difference. We can see in the before and after pictures there that quite a difference there for people. So, and is it usually just a one-time procedure? Like, do you do it once and that's it?
Usually it is a one-time procedure, yes.
Okay, wow. So, well, you are at the Optimize Live exhibit this weekend at Exhibition Park in Halifax. It's Saturday and Sunday, so you can check out the Atlantic Vein Clinic's booth there. So, Doctor, thank you very much for coming in.
Thank you very much for having me.
We are going to take a break here on Breakfast Television. We will be right back in just 2 minutes.